Tell me why it is that you started off working in the field of disability.
When I saw that question, I found it quite interesting. So I come from a family of persons who are in the field of helping others. My mother and grandmothers were nurses, healthcare providers, they were teachers. And so, yeah, I chose to become a psychologist though because I wanted to help people to make a difference. But when I went to UWI, my first year, I went into law. I wanted to do law. But then I got interested in studying my psychology courses. I'm fascinated by how people's minds worked and how they behaved when they were under stress. And the rest is history. So my first interest was law because I was a history major at convent, but then I switched at the university.
Your primary interest seems to me to be mental health issues, or could you just tell us a little bit of what you mean by mental health? Because I used a term yesterday and somebody says, oh, that comes under health, but it doesn't really. It comes under disability as well.
Correct, because a lot of people want to confuse mental health with physical health, and it's a separate issue. You know, as a psychologist, I did both clinical and educational, but I was very much interested in, especially with children, what prompted them to make the kinds of decisions. But if we have to give a definition of mental health, this includes emotional, psychological, physical, and social well-being. You know, it affects how persons think, how they feel, how they act. And an important dynamic here is how resilient they are when they cope under stress. You know, but so that mental illness is the opposite of all of that, the inability to cope, the inability to really rationalize and to think clearly and all of that. Because your mental well being affects the choices you make.
And of course, that has led to your interest in issues such as suicide, which I know you are at the moment deeply immersed in.
In Trinidad, we're looking and decriminalizing suicide. So we're hoping to have legislation in that area.
Before we go to talk about legislation, it intrigues me the fact that we have so many suicides or potential suicides around UWI in particular, around Trinidad. I mean, I know so many people have schizophrenic or suffer from depression or suicide. Why do you think in Trinidad, because I have two questions in this, why in Trinidad do we have so many people who are confronted with issues of mental health, mental illness, and also problems of suicide?
Mental illness is always triggered by some kind of trauma. In the Caribbean specifically, we are always highly vulnerable to disasters such as earthquakes and floodings, and more recently in our country to illnesses and deaths, and recently the COVID-19. So if we look at the historical standpoint of the Caribbean, all of these affect persons, the impact of any disaster, whether it's human generated or natural. And this affects the mental health of our population. What is interesting is that in this part of the world, mental illness, it is not given the kind of resources and the kind of attention that it should. You know, I've always spoken about this, especially where children are concerned. And of course, if you were saying the university, many adult mental illness issues stem from childhood, stem from youth. And when you're talking especially about things like schizophrenia is typically diagnosed with in the late teens to early 30s, and that is the time when children and young adults are at the university. All right. And of course, at the university comes its own kind of traumatic issues, you know, studying, bullying, parents who may have trauma
Too many high.
and a lot of persons not where that last Christmas. University students took their lives on the campus of St. Augustine. Every day in Trinidad now, somebody takes their lives. In the region, Trinidad was our third highest for suicide rates. Guyana first, Suriname second, and Trinidad third. But now, I think we are in fifth position, the recent statistics show, with Cuba third, Haiti fourth, and Trinidad fifth.
But is there the same kind of stigma attached to mental health, to mental? Do you say psychiatric illness? Is that the correct terminology? What is the correct way of saying it?
Most persons feel that illness is triggered depression or triggered by some sort of psychological issues. As I told you, I'm researching youth suicide and I'm seeing different factors surfacing here, for example. So that young persons, I think, they tend to lump young persons, young adults, into the same category as adults, not recognizing that the developmental phases or the maturity is not the same. So that the triggers, I think, for young people tend to be a little bit different. So adults may be very susceptible to mental illness, having previous issues with mental illness, susceptible to depression. But when you look at the young people, especially in Trinidad last year, our youngest male, 9 years old, taking his own take. And the youngest female with suicide ideation was 11. But when you look at those factors, they are not yet mature. What are the kind of impulses or triggers that would lead these young people to think of suicide? I'm thinking young children are led by impulses. So they're angry at parents. They don't get what they want. They bullied by others. They feel isolated and they make a decision to take their lives. So there may not have been a history of mental illness per se. So I'm looking at those and I have classified it in the moment. In the moment, young people tend to be very impulsive and they feel hopeless and desperate and they make that decision. So the factors are different, I think, for developmental groups. However, when you look at stigma, if we look at that word and we break it down a bit, stigma is a fear of something that is not understood. And that is what is happening with mental illness. If you look at the Caribbean, we have had a culture of silence for generations where parents say, don't tell anybody what's happening here. So that persons are very reluctant to talk about how they feel, what is happening with them. People view mental illness also as a sign of weakness. How come you're not better able to control your life? How come you're not better able to be more resilient? So persons may be viewed in a very negative way, I'm thinking, treated differently and made to feel ashamed or embarrassed about their mental illness. And as I said, the culture of silence surrounds a lot of these issues, especially in the past, which prevented persons from admitting that they needed help, from seeking the help that is out there. I was part of a GSC, the Joint Select Committee in Parliament when I was president of the Association of Psychologists in 2017. And they were looking specifically at mental health and what is the legislation that they should put in place. And some of the conclusions from this GSC committee in 2017 was the negative stereotyping and the stigmatization of mental illness led to the underreporting of it and the low diagnosing of mental illness, especially within the society. And another conclusion was that mental health professionals themselves confirmed that this phenomenon was evident. And mental health professionals sometimes are not trained, let's say, in looking at what are some of the red flags for suicide. I've spoken to many doctors as a professional, and many of them said that persons come into, let's say, emergency the wards and so. And many of them believe, the doctors, that these were suicide attempts, but it's not classified as such. It's classified as an accident. Maybe the person fell or the knife or slipped when cutting. And I think, therefore, we need training and development, especially in those situations, to really, really collect data that tells us what's happening within our populations.
So you have a combination of silence, stigma, shame. Do you think that has fed into the fact that we don't have any form of protection? When I consider we have no form of real protection for people who have psychiatric illnesses or who in fact might have a disability per se, because other forms of disability also carry stigma, also carry shame, and also create silence. How do you link this to the notion of the lack of protection? Because I know part of what you're doing surrounds this whole area of new legislation.
Correct. And if we just go back to stigma, the harmful effects of stigma could include the reluctance of persons to seek help, to be treated, the lack of understanding by family and friends and co-workers of what's happening. And you want to hide away at your home, especially if you feel that way. So there are fewer opportunities for persons to get out there, to go to work, to go to school. We have persons and children socially isolating themselves. And this is a major trigger which leads to hopelessness, which leads to attempted suicides and then completed suicides. So it's like a dynamo effect. Now, I think lately in Trinidad and Tobago, attempts have been made to address this issue. So it's not under the covers, as I would say, let's say 10 to 12 years ago. From the 2017 discussion in Parliament, one of the things I had suggested was that there should be a mental health action plan for children and adolescents. Out of 38 mental care facilities in Trinidad, only one facility was for children. That's ridiculous. And many children who were diagnosed with psychiatric breakdown, schizophrenia, they were sent to the adult wards in St. Anne's, where possibly they were exposed to a further kind of
Lord knows. I know.
So from 2017, they introduced 4 beds at St. Anne's for adolescents, and and I think 9 beds at Mount Hope Hospital. But that is not enough. We have many of our young people, and I stress on this because globally between the age groups of 15 to 29, about, let's say before COVID, that was the fourth group to take their lives, or the fourth highest group. Now in 2024, it's the second highest group to die by. So it's increasing, it's not decreasing, and people are not recognizing, I think, Jean, how serious it is. They're ignoring the red flags. They're ignoring that young people need help because, as I said, most trauma, most mental illnesses start before 14 years old. 50% of adults who suffer with mental trauma, the root is in their childhood and adolescent years. That is why it is so interesting to me, because we got to be a society that is preventative, not intervening or post-ventative when it happens.
Do you think that laws, what kind of laws do we need?
If you look at, let's say, the Mental Health Act, whilst we may have a law that is trying to put things in place, it is not enforced. We have to look at, I think, two important areas as regards mental health. One, the law for disability, to regard mental health as a disability. And secondly, corporal punishment, that looks at corporal punishment in homes that is significantly not enforced or not addressed. We have to review what is happening there and put many amendments as regards those specific two areas. Because if you look at those two things, it leads to mental illness, to the increase in mental illness, etc. Let's look at, if you want to look at the laws, and I know you had asked the question, what are the laws that discriminate or target persons, etc.? And we have a Mental Health Act, Chapter 28.02, under the laws of Trinidad and Tobago, that provide for, one, the admission, the care, and the treatment of persons who are mentally ill, and for matters connected with that. What we do not have is a fair distribution of resources. Comes to the provision of these services, equity. But this is a pet peeve for me, Jean, because I've always,
And that's a big thing at the moment, yeah?
so we always talk about equality and equity, mixing up the two. They're not the same.
They're not. No, they're not. No.
Politics that the government have, there are a lot of mental health clinics there. There are people who can access services and so, but equity means that what is happening to persons who cannot accept these, who's coming from rural areas. Something that $5 may not mean much to a lot of us, but it means a lot to the person who has to go from where he's living to a mental health clinic, to take a taxi, 3 or 4 taxis coming out of those areas. So we may have equality, we may have services, but there is no provision for equity, no provision for a fair distribution of resources.
That's right. For helping those who are less able to help themselves.
And especially for women, so it is recommended that this policy document, one, we have all of this this policy document must inform amendments to the Mental Health Act, the Children Act, the Children Authorities Act, and any relevant law that comes into being here. It has to guide us in expansion of facilities to provide mental health. It has to guide the strategy for the development of human resources for the treatment of adolescents and minors. We do not have persons to treat these people. We do not have persons that are intimately involved in that. We have internationally accepted standards, but as regards guiding the collection of data by relevant stakeholders in mental health, how often is that? How significant do we consider that the collection of data would help us in one, decreasing stigma, in public awareness of the issue, in addressing certain things.
So basically, what you're saying is that we need additional resources, we need equity in the system, we need enactment of laws, not just laws, but we need the capacity to have those laws enacted, which is a big thing in Trinidad and Tobago. So, what do you think that we as activists, what should we be doing in terms of impending legislation or draft legislation, or in terms of sensitizing the public? What should our actions be?
So, Jean, they talk a lot about what should we do, what should be done, and so. And I think the first thing has to happen to change is that stereotype surrounding mental illness and so. There's a mindset in our society that stereotypes and devalues the lives of disabled people. No one is willing to take responsibility for this until, as a society, we begin to value diversity, become willing to stand up for marginalized people because it is the right thing to do, the ethical thing to do. Then, no matter what law we have, what policy we have, nothing would help. Because when you look at law and policy, that it is looking at a particular echelon of society. Those persons dropped in the bill, those persons who are possibly into research looking at these, but what happens that filters down to the ground, the layman, the awareness of these issues, the awareness that this policy is trying to make a difference. So if we're looking at as activists, what do we need to do? The first thing is to public awareness of these.
Public awareness, yes. That's a worldwide recognition of that. And I think the worldwide disability organizations have said that's the first number one for all groups.
Right. And secondly, persons, I would say, helping persons with mental illness to examine what are the biases and factors and fears that prevent them from moving towards improvement in their own mental health. They are so kept back by what families would think, by what their colleagues on the work would think, by what persons would think about if they were to address their mental health issues. So we have to, in the public awareness program, address those implicit biases that come from the home, those factors that prevent people from seeking help for fear of exposing their weakness, if we were to put it in inverted commas. As activists, as I said before, we need to provide more training and development for mental care providers, for social workers, for persons who interact with these groups of persons with mental illness. Something I found while I was working with this population, they need to understand the background and the culture and the belief systems of persons with mental illness. Look at what is the ecological context, because it is a fact that certain ethnic groups in our society take their lives at a greater rate than other ethnic groups.
Which ethnic group is this? Or which ethnic groups?
The East Indians. And I think it's because if you look back to how society was before, when there was this family connect, and if you look at the East Indian families where they were extended families, 4 or 5 houses in one backyard, and persons connected, now there is a social disconnect in our society. A social disconnect that leads to hopelessness, that makes you feel that you're isolated, nobody cares, nobody listens, and so. And amongst, for me, the East Indian population, especially among the young persons, especially males tend to take their lives, and because amongst the young population now, another factor that is overlooked are the LGBTQ factors in the society, that again, nobody wants to address, nobody wants to talk about, that exist in families. So when people feel socially isolated, when they feel nobody is listening, when they feel society doesn't care, and that is a dynamic that comes up because over the last week, I asked a couple of clients, especially one person, why are you in the hospital so often? She was referred to me after 4 suicide attempts. She said, I feel that society has failed me. I fear that there is nothing in place for young persons, and against a backdrop of a high crime rate, of a hopelessness, of a grieving, as I call it, a blanket of grief in Trinidad that pervades our society. You have young people who are not seeing any light, any windows to give them a path.
That's why I would have thought, I'm surprised when you say the Indians, because Indian population, because I found with my black students that they were far more hopeless.
Maybe they may have suicide ideation, but as regards completed suicide
Yeah.
thing, suicide ideation is 5 times higher than completed suicides. And let's say I'm a university lecturer, I always address suicide, especially because I know I have a target population of young people. And Jean, you will believe more than 60% of them, it could be higher, think of suicide from time to time. The suicidal ideation is very high, and amongst that group, you may have maybe about 2 or 3% of them completing suicide, which is again very high. Those are the things I think that we need to address in our society as we move forward. Our history, our ecological backgrounds, the facts that persons are, you know, sort of giving a blight to young people as if, they could fix it on their own, but they can't. We need support systems. We need more child guidance clinics, more child and adolescent centers. We can't have one child guidance clinic in the entire country. Come on.
I know that amongst my own students, I could not believe how much incest there was. How many of them were intimately knowledgeable about things like incest or abuse, or, all of these things are feeding into all the problems that we're talking about, and I try to write about these things. But I don't think we also ever address these issues. So there's a whole arena,
I,
you know?
as I write in some of the articles, every other woman or young girl in our society has been sexually touched or abused. Every other person. And I feel that even though that may look like 50%, I think that is increasing to 60 to 70%. Girls are
And very often family.
when that girl who recently died, Hannah Matua in Valsane, and that Lalith girl whose neck chopped off 9 years old. As I said, 88% of children who are murdered is done by family members, persons they know. A higher rate than that are persons who are sexually or physically abused.
I know.
Yeah. So these are things, as I said,
Taboo subjects, taboo.
as I said, we need to attack those stereotypes, those persons who believe, let's say, and if we go back to the East Indian society, when they were looking at the the Children's Act, and they said that children in Trinidad and Tobago should not get married before the age of 18. East Indian communities came out against that Children's Act. They said you all can have how much legislation you want, but we're not going to enforce that. Because in our community, in our Hindu community, young girls can marry by the age of 12.
I have so much to write. I don't know how I'm going to put this into 900 words, but is there anything that you think that you would like to add?
My main concern really is, as you said there's nothing with non-intellectual disabilities, and we do not understand these issues, I think, even as educators, even as teachers in the system. When children show certain weaknesses or deficiencies, the first thing they say is they're not trying hard enough, or
No.
they don't understand. Even I have a big barrier with the Ministry of Education when I do assessments for children with disabilities. I do not think that a lot of those who do assessments understand really what needs to happen with children, which is why we have such a backlog of children waiting to be assessed 2 and 3 years, and many of these children drop out of the system. Last November, imagine our Minister of Education came on radio to say that 100 children in primary school between September to November had left primary school, and 300 secondary school students. And you have that kind of data of children leaving because of feeling as if they belong in a school, they're intellectual disabilities. And there is nothing to back up that data as regards solutions way forward. And so I was really disappointed in that's why I'm saying that, yes, why we talk about it, because I have all of these laws, all of these policies, but if there is no follow-up, if there are no interventionist procedures at the moment of prevention before it happens, a lot of our learning challenges and problems in the schools stem from the learning challenges and disabilities of our students. And as I said before, principals, refusing to allow children into their schools because of their disabilities. That because of the worst thing ever, So again, a lack of understanding, Jean, a lack of acceptance of what we have here, not addressing the stereotypes, not addressing the cultural barriers to advocacy and all of these things, I think needs to happen. I think Trinidad is ripe for legislation to happen where disability is concerned.
Yes, but and I'm going to close here because this is another conversation. The whole problem, as I've discovered being on the LAT group, is that we pussyfoot around our legislators and our politicians. What I'm constantly hearing is, oh, if you make too much noise, they might enact anything at all. That's it.
Well,
That's what we asked the word about activism.
yeah, that's one of the questions when you asked me. I said we cannot be silent on issues. We cannot, as activists, we have to be very forward in our thinking. We have to really examine what are the biases, and so we have to be willing to take responsibility for
And action.
action. Yes. And because it is a right, we have to be willing to stand up for disability and marginalized groups. We have to be. I said it on an interview, and I said our voices, it cannot be shoo, 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 look at what is happening. We have to, and if they don't hear us, we have to say it again and again and again, knock on the door and break it down.